Good afternoon, everyone. Welcome to the Thursday, February 9 meeting of the Emergency Medical Care Advisory Board. We're going to call the meeting to order. And Kathy, would you mind leading us in the flag salute? The flag is right behind us. Thank you. That's the hazard of being at the desk with the person who's known you the longest. So you get to do flag salute. Jana, would you please call the roll?
Certainly. Supervisor Maggard.
Here.
Mr. James Miller.
Here.
Mrs. Prout. Yes. Mr. Surface.
Here.
And Dr. Lyon.
Here.
We do not have a quorum.
Thank you. That means that we can't take official action, but we can still hear reports and allow the public to have an opportunity to make comment to us. So we will forego adopting the consent agenda. We should back up for a moment. I should explain. There are a couple of things that are occurring that are taking, for example, city managers across California are meeting at one of their annual get-togethers right now, and the Police Chiefs Association representative for us is Sheriff Youngblood, and he's in D.C. at the annual sheriff's thing, so that's why there's typically would have more people here, but we just don't this time. So, Jana, should we mention the things about what's on consent just briefly, because we're going to vote on all of them later, or do you think that's even necessary to do?
I'd refer to council.
There can be no formal action on these, so it's as if a meeting has not taken place.
Did anybody come today wanting to make comment about anything on consent? Then let's just defer them till when next we meet and we can adopt them then. Okay. Are there any members that our next item for today is public comment? Are there any members of the public that are here today that would like to make comment to us about anything that is not otherwise on our agenda? Seeing none, we'll go forward then to our director's report, which is item 11 on the agenda.
Thank you, Supervisor. I just have a quick update for you on some of the items that we have been working on and have achieved over this last quarter for the EMS Division. We have 2 new pediatric hospitals in our system. Delano Regional Medical Center completed the requirements for a level 4 pediatric receiving center, and Ridgecrest Regional Hospital recently completed the requirements as a level 3 pediatric receiving center. And so this is a great addition to our system, and it improves our pediatric care in some of our more rural areas. EMT services, we've recently approved M&S Security as a non-transport EMT provider. They primarily provide EMT services out in Elk Hills area on the oil lease. They are a 24/7 provider of at least one EMT on duty out there in those areas. They have specific requirements that they have to meet as far as training, equipment, and medical direction, oversight, and approval with Dr. Lyon's approval and accreditation of their EMTs. We continue to work with other interested parties to complete requirements for program approvals for other non-transport EMT provider agencies. Kern County Fire Department has asked us to revise some of the reporting methodologies for the dispatch centers. They're requesting a change in our division-approved format, which will provide them a more efficient way of reporting on their performance compliances. What they're proposing is to pretty much forward us the same reports that they give to the International Academy of Emergency Dispatch for their accreditation. They take the information from one report and put it into our format and send it to us. Now that we have just 2 emergency medical dispatch centers, it's easier for us to compile the information. And so we agree with their suggestions. We'll be working with the EMD QI group in March to iron out the details of the reporting requirements for them. Division education, we continue our efforts to increase the number of people in Kern County that are trained in hands-only CPR. I spoke at a cohort of skilled nursing facilities recently to promote disaster preparedness and promote pulse point usage. Mr. Baker met with the Kern High School District to promote Pulse Point and division-sponsored CPR training for high schools. There will be a new mandate implemented that all graduating seniors in California will have to have had at least hands-only CPR training before they graduate. So we'll be working with the high school district to augment their needs or see if there's any way that we can help them achieve those goals. Mr. Neiswanger went up to the Kern River Valley post-wildfire community information meeting. And this was in regard to the flood and the severe weather that we've been experiencing up in the burn scar areas. So he spoke on and provided information to residents on how to prepare for the weather, having an emergency plan, and represented public health interests. I would like to point out that our EMS division was recently recognized by the county for exceptional teamwork. And so Mr. Baker and Mr. Ferris are here today with us, but they did receive an award, a county award, for excellent teamwork on their work with the Erskine Fire. A quick update on our Pulse Point app. As of January 31st, we had 1,331 people signed up for the app in Kern County, and we currently have 181 AEDs that are in the app. We received, on the report, there was one person that suffered sudden cardiac arrest in a public area that was reported on the last month's report. No alerts went out, and so I have an inquiry into the Pulse Point Foundation to get more information on that incident. I suspect it is because there is nobody within the radius of the patient that we had set, but I want to confirm that it's appropriately working and making sure that we're covering all of our bases there. The last update I have for you is our NEMSIS 3.4 conversion. We're continuing to work with all EMS service providers to meet the state requirement. The state requirement is an electronic PCR format and transition to the NEMSIS 3.4 platform, so it's just a movement of a data platform from a previous version to a newer version. This has been mandated in state law with AB 1129. And the state set up a deadline of December 31st, 2016 to be moved over. We currently do not have any provider on the new platform, but before data can be transmitted, a demographic file for each agency has to be submitted through our web service and sent to the state for approval. So currently Liberty Ambulance has submitted the demographic file for their agency, and it has been approved by the state. So we're continuing to work with their vendor to get their data submitted. And Hall Ambulance has also submitted their demographic file, but we are still waiting on approval from the state for theirs. Once the state approves their demographic file, and then we can continue to work with the Hall Ambulance vendor to transition the data into our database. We continue to reach out to other provider agencies and attempt to identify their plan of action to meet these requirements. This is a long process, and it's an arduous process up and down the state, and so it's very difficult and slow going at best. But that concludes my presentation. I'm available for questions if you have any.
Thank you. Do any members have questions for Shanna? Any members of the public have any question or comment? Okay, we're not going to receive and file today because of the quorum issue. So next up on our agenda is an opportunity for board members to make an announcement or report to us about any observations you have or things you've been up to or anything at all like that that's good for the order of the day? Service?
On May 20th, we have started, Hall Ambulance started working on an EMS week celebration. We haven't had one in many years. We've started working with, we've invited to the first meeting all of the first responder agencies, all the hospitals in the county. Everybody's sitting at the table right now. We'll get invitations and we'll start planning, and it'll be somewhere between 2 and 4 hours on Saturday, May 20th. But it's been a couple of years since anything was done in the county to recognize EMS folks during EMS week. So we're gonna try and tackle that.
Be good. Will there be like an opportunity for the public to come?
Yeah, it's gonna be Pioneer Village. We've already booked Pioneer Village for the day, and what it's gonna look like will depend on what our partners decide they want to do with it. But the idea is that ambulances, fire trucks, helicopters,
That's great.
all the different resources will be on static display.
Yeah, good.
Different organoxies, hands-only CPR, different things that will be available to the public.
Well, thanks to you guys for taking the lead on that. Anybody else? Okay, I have a couple of announcements to make for us. First one is, it's item 14A on your agenda, if you're looking at that. Our next regularly scheduled meeting is Thursday, May 11, 4 o'clock in this room. And the second announcement is that the deadline to submit something, a request from the public to be on that agenda, is Thursday, April 27th at 5 p.m. Upstairs in the EMS Division Senior Emergency Medical Care Coordinator's office. That would be Jenna. So without anything else, we don't take action, so I will just, as the chair, adjourn the meeting here at 4:15, and we'll look forward to seeing you guys again on May 11th. Thanks, everybody.